Welcome back to our video series from our End of Life Care Pack. I'm Dr. Rachel and I'm a vet from Rest Your Paws. The End of Life Care Pack is a 36-page resource aimed at helping families through one of the most difficult times in their pet's life. Today I'll be talking to you about what euthanasia is, how to make this decision and how we can help make that decision a little bit easier for you, and also about what to expect on the actual day of the appointment. These things are all so important because we know that it is an incredibly emotional time for you and your family, and we are here to make it, hopefully, just that little bit easier. Euthanasia refers to ending an animal's life in a compassionate and gentle manner. Compassionate euthanasia is often recommended when the quality of life of the pet is no longer acceptable, and that may be caused by either the aging process and the issues that can come with that, if the pet has a terminal or chronic illness, or if they are experiencing a degree of pain and discomfort within their life that is no longer conducive to a happy and healthy one. People clearly have a lot of questions about how the appointment will actually run and what to expect on the day. So I'm just going to go through a brief overview of what you can expect to happen. Essentially, the vet will arrive at your home and obviously introduce themselves to you and your pet. And what we ultimately want is for the pet to feel as comfortable as possible throughout this procedure. So initially, we give the patient a little injection just underneath the skin, which carries with it a calming and sedative type medication, which will gradually transition them into a state of very light sleep and then a deeper sleep as it starts to take effect. And that can take anywhere between 5 to 20 minutes, depending on the situation. And once the patient is calm enough that we can touch their limbs without them really reacting or noticing, we'll just clip up a little bit of hair on one of their legs and place an IV cannula, which at that stage the pet is not able to feel or even notice. And even though they will look fairly, sleepy and in a dreamlike state, they'll still be able to very much feel you and hear your voices. So they will be able to know that you are there with them. The final medication is essentially given directly into the cannula, which initially start to circulate through the body and deepen the plane of sleep that the patient is in. And then as we continue to inject the medication, essentially it causes the patient's breathing to begin to start to slow down, usually within a couple of minutes. And then eventually the heart will come to a stop. Deciding when to put your pet to sleep is one of the hardest decisions that you will ever have to make. And it is very rare in your life that you will be responsible for being the voice for someone that you love so much. A lot of the uncertainty around this decision usually stems from, you're not wanting to make the decision too early and missing out on time with your beautiful pet, but also from not wanting to make the decision too late, and then of course your pet experience further pain and suffering. So we completely empathize, and that is where we step in to hopefully help make the decision a little bit easier. Thankfully, we actually have some resources available, including pain scoring tools, quality of life assessments, and also individually tailored information about what to expect when your pet's disease, is likely to progress and what that will look like. So we have those resources available on our website, and also in person we can go through this information to be able to assess your pet's quality of life and to also help guide that decision-making process. Thank you so much for watching. We hope you found this content helpful. If you would like to find out more, please like and subscribe or visit our website, restyourpaws.com.au. And if you would like to follow us, you can also visit us on social media at Rest Your Paws AU.